and we're going to look at licit and illicit drugs. And then we're going to talk about what kids are taking and also what we're supposed to do. So they show up in your clinic, what are you going to do about it? So there's 2 big surveys that are done annually looking at what kids are taking. There's the High School Youth Risk Behavior Survey. And so in 2014, we have the 2013 results. And what they looked at is grades 9 to 12 in 45 states. They collected data over a few months. And you can actually download this yourself. I've got the website there. And then there's also the Monitoring the Future. And this is a long-term study. It's been going on since 1975 at University of Michigan. And what they do is study the changes in the beliefs, attitudes, and behavior of young people in the United States. So they look at a lot of different things. But they really look at, they do surveys at 8th, 10th, 12th grade college students and young adults. And if you want, there's their website. So what's really nice is we have really great long-term data from them. So let's sort of see what is happening out there. So when we look at our surveys, basically alcohol use has gone down, even though it seems like they're drinking a lot. I don't know about you, but it seems like they're drinking a lot. It actually has gone down over the last 20 years, and about 34 to 35% of kids are in the last 30 days have used alcohol. If you're looking at the Monitoring the Future, they looked at 12th graders. They saw a decrease from 54% to about 40%. If we look at tobacco use, it's also going down, although this one might change with e-cigs. So it has actually steadily gone down in both of the surveys. We're doing a good job. People are getting the message. They're, and also one that they ask it slightly differently. That's why their answers are slightly different. Some ask about last 30 days. Some say daily. They don't. So you could do the same survey with the same group, and you're going to get a slightly different statistic because of the way they ask the question. Okay, back to nursing research 101. When we look at illicit drug use, we look at 50% of 12th graders, or 50% of kids have ever tried it. Okay, so that's a lot of kids have tried an illicit drug. That's actually surprising to me, but probably not surprising. 12th graders, if we look at just 12th graders, 25% have used an illicit drug in the last 30 days. Marijuana use, no surprise. 41% or so have ever used it. In the last 30 days, we have 22.7. Synthetic marijuana use, we have 7.9% of 12th graders have used it. Ecstasy, which is kind of a scary drug, which we're going to talk about in just a little bit. We've got increased use over the last 4 to 5 years. So we've got 6.6% of those kids. So this is sort of our picture. They're using it. This is actually going up instead of down, not the right direction. This is the Monitoring the Future long-term data. So what these are, because I know you can't see this, the green are the 8th graders. Thank goodness they're at the bottom. All right. The blue are the 10th graders, and the red are the 12th graders. So actually, something we did here, I don't know why it went up. We were coming down, and then in the early 90s, we went up, and now we're kind of staying there with our 12th graders. Same thing. We went up, and now, we're not so good. I mean, I don't know what's going on here. Why are we're coming down, but what was happening? So I was in practice in 1996, which is where these peaks are. What happened? What was going on then? I don't know. Why do we see these peaks? This is any illicit drug. And then we have other than marijuana. So now you take marijuana out of the picture, and it's lower, good thing, right? And it is sort of drifting down. So this is confounded by marijuana, which is probably why it's going up, because our marijuana use is going up. So we're kind of doing at least it's not going up, So what is going up, though, is illicit drug use, which is over-the-counter prescription drugs. And if we look at dextromethorphan, 5% of 12th graders have abused cough syrup in the past year. That's a lot. I mean, that's kind of scary, actually, especially when we start talking about this. when we look at non-medical use of prescription drugs, 21% of our kids have done non-medical use of prescription drugs. So we're talking giving their friends some Adderall, taking their parents' narcotics. The data is pretty clear. They're getting it out of their parents' medicine cabinets. When you look at the YRBS study, 17.8% report doing this, and they listed out the drugs on that survey. So we're talking hardcore drugs: OxyContin, Percocet, Vicodin, codeine, Adderall, Ritalin, Xanax. Okay, that's a lot of kids. What bothers me is we are contributing to this. You know, my son had his, or prescribers, I should say, are contributing to this. My son has wisdom teeth out. He got 30 Vicodin. You know, if you need that much Vicodin after your wisdom teeth are coming out, there's something really wrong. I mean, you know, after a day or so, you shouldn't need anything but ibuprofen. They should give him like 5 or 10 at the most. So what happens is they're going to the ER or whatever, and everybody's giving them 20 or 30, and they really only need it short term. So there is a movement and a push to really talk to prescribers about what the heck are we doing? We're way overprescribing these opioids, and our kids are getting them, clearly getting them, but we're also prescribing them to kids at great amounts, way more than they need. And so they're also abusing hand sanitizers and caffeine. So let's sort of talk about these. We're going to walk our way through. So we're going to talk first about K2 or spice. This is a synthetic marijuana, a synthetic cannabinoid, and it is widely available online in gas stations, convenience stores. There's multiple synthetic cannabinoids, and what happens is when one of these, so the DEA regulates these, but they regulate the actual chemical structure. So what happens is the DEA will say JWH018 is a Schedule 1. So what they do is they reformulate it and they make a new formula that is not regulated anymore. So you're going to say, I thought those were illegal. Well, they are illegal, but not all of them, because if they've been reformulated and the chemical structure hasn't been identified by the DEA yet as being illegal, you can still go buy them at the convenience store or online. So what are the cannabinoid receptors? These are the ones that make you feel good, okay? And so these are the, give you the physiologic and psychotropic effects of THC. And we have a medication. We have Marinol, which is a legal THC that's made, we use for cancer patients. We also have marijuana. I'm not going to talk about marijuana today, by the way, because that is not, that's outside the talk of this. This is more outside of marijuana. But definitely kids are smoking pot. So, spice and K2, so it's used just like marijuana. It's smoked in a joint or a water pipe. Because it's inhaled through the lungs just like marijuana, it has a fairly quick onset. It gives that same sort of feel-good, elevated mood feeling. The interesting thing that it does is if you're trying to figure out if a kid has done spice or marijuana, so if they've done a synthetic marijuana or not, is they tend to get nausea and vomiting with these, and they don't get nausea and vomiting with marijuana, okay? Because marijuana actually treats nausea and vomiting. It works at the THC receptors in the chemoreceptor trigger zone in the brain and decreases nausea and vomiting. So these kids may be thinking they're buying marijuana, and actually what they're buying is some plant material that's been sprayed with this synthetic stuff. And because that's what it looks like. It kind of looks like marijuana, and not the buds. It looks like sort of the, and you know, these kids could be naive too and not know what they're doing. Who knows? But so they do get tachycardia. They do have the increased appetite, but the nausea and vomiting. And Jim says that's often how they tell whether these kids are doing, because they won't necessarily show up on a urine drug test. So the symptoms last for 6 hours, and if you do a standard urine drug test for THC, it's going to be negative, okay? So these aren't going to show up on your drug tests. So there have been a lot of poison center reports on these, and in just November and just this last few months, there have been a whole bunch of reports on this new stuff called Cloud and Mojo. and they're having significant hallucinations and aggressive behavior and suicidal thoughts. So it must be a new formula of spice that's out there that's called Cloud and Mojo. New Hampshire, the governor declared a state of emergency in August due to 41 overdoses from this synthetic marijuana called smacked. So one of the issues is that one thing about legalizing marijuana, whether you believe it or not, is you actually have a production process that is somewhat regulated. People go to the store, they buy what they actually are buying, right? It's marijuana, they're buying marijuana. This is a totally unregulated process. We have no idea what people are putting in these and labeling it as this. So that is what people are buying. We don't know what they're buying. And so there have been a number of problems caused the Poison Center. We're seeing seizures, we're seeing tachycardia and hypertension, we've seen high fevers, hypokalemia, chest pain, kidney failure. In Oregon, we had, in a 6-month period, 6 cases of acute kidney failure. All males, median age 18 years. In Oregon and Southwest Washington, they all had smoked spice, right? And so this was a problem. In November of 14, it's cutting off my page again, sorry about that, I gotta find the right one. In November of 14, the National Institute of Drug Abuse put out an alert about a substance that was labeled Crown and Cloud 9. And this one, what they found out was sold as a liquid in an eyedropper bottles and used in the vaporizing devices, you know, the hookah smokers. Okay, so they're using it in a hookah smoker, and a whole bunch of kids in Michigan were hospitalized. And so they put out an emergency warning on that. And so, you know, it's sort of like we're trying to stay ahead of this, but this is like, it's always playing catch up. The way we figured out is you get all these kids that show up in the ER and the Poison Center calls, and then there's like, oh my gosh, what's happening? So let's ban that, right? And then the next one happens, and the next one happens. This is a moving target, and so if you work in the ERs, you might see this. If you're working in clinic, you might see this because it's out there. One of the biggest worries is psychosis. The military actually, because, you know, they do random drug screens in the military. I live close to a base. And so they have a lot of data because all their urine drug screens they do. And they found they had they published a series of 10 cases of 21 to 25-year-olds who were all admitted to inpatient psychiatric units after they developed psychosis from the synthetic cannabinoids. And they found that the psychotic symptoms lasted 5 to 8 days. And one patient, it was 5 months. And they don't know why. Okay, that's what's really scary about it. They don't know why. Why? You know, 100 people do it. Why do these kids develop psychosis? And so they're wondering, it's clearly triggering acute psychosis. Are these kids, did they have an underlying propensity to schizophrenia, and now the medication has sort of triggered it, and now they're going to be schizophrenic? We don't know. But that's a really scary thing when you're seeing these clusters of cases from using these. So if they show up, okay, let's say they show up in your clinic or whatever, we need to give them seizure medicines and because they can seize on you, and we give them antipsychotics if they're psychotic. We basically chase the symptoms. We need to monitor their heart and liver function because they can develop some cardiac dysrhythmias. They can have some liver dysfunction also. So, you know, these can be pretty significant. Most of the kids just smoke it and they do fine, right? What we hear about are the ones that don't do fine. There's lots of them out there without Poison Center calls. Salvia. Now, salvia to me is the plant that you put along the border, that blue plant, and, you know, it's like, but, you know, I talk to my nursing students, they've all heard of salvia, you know? I'm like, you have? So, yeah. So this is an herb. It is a member of the mint family. It is used in Mexico and Central and South America as a hallucinogen. The shamans use this for religious purposes. It's grown and shipped up here for its hallucinogen effects. If we look at 12th graders, 3% of them have used it in the last 12 months, 1% of college students. It's used for its hallucinogenic effect. What it works on is the kappa opioid receptors in the brain. So we know where it works, we know what it does. And the way they use it, it can be chewed or smoked. And if you chew it and hold it in the buccal space, and you get absorption. It starts to work in about 5 to 10 minutes. And then if you smoke it, you get the effects within 30 seconds. And it lasts for about 30 minutes. So you get hallucination for about 30 minutes. So, I mean, it's better than mushrooms. You know, mushrooms can give you liver failure. So, you know, anyway, it's pretty scary. So what do I do for them? One good thing is pretty short acting. It doesn't hang around very long. It only lasts for about 30 minutes to 3 hours. So if they show up and they're hallucinating, they can have these huge mood swings. Their big risk while they're hallucinating is actually self-harm. They can walk through windows. They can walk in front of cars. You know, that's where the risk is. If they're sort of kept in a safe place and you just watch them. So if they show up and they're hallucinating with this, so you can just buy it at the, off the internet. Just get a little baggie of stuff. And you just put them in a quiet place and you monitor them. You watch their neurologic status. They don't tend to have seizures or anything with this one. And after a bit, they sort of come out of it once it wears off. So of all of the ones we talk about today, it's probably the most benign. But, kids are out there using it. Ecstasy and Molly. This one, actually, Ecstasy was developed by the Merck company. It was used by some therapists early on. It was from 1912. It's been around a long time. It is actually methamphetamine. So see that methamphetamine in there? It basically has the structure of the stimulant methamphetamine and the hallucinogen mescaline. So you kind of get a two-stage approach to this. I'm going to talk a little bit about that in a second. We all know it's used as a party drug. It's illegally manufactured and smuggled into the United States. The one problem with this is it also usually has something else in it. It may have ketamine in it. It may actually have methamphetamine in it. It may have ephedrine in it. It can have all kinds of things. What it does is it gives you like amphetamines, it gives you a surge of neurotransmitters, dopamine, norepinephrine, and serotonin. And unlike just straight amphetamines, it gives you more serotonin so that they get that feel-good. Serotonin is our feel-good neurotransmitter. And so one of the things that happens is they get this surge of just like amphetamine effects, and then they get the feel-good effects. And I'm going to talk about that more in just a second. Tolerance occurs to this. So tolerance means you need more to get the same effect. So what we see with chronic users is they stack their doses. So they take more and more so that they can maintain the drug's effect. So they take a dose, then they take another dose, then they take another dose. So that's a way that it's used. This has an onset of 30 to 60 minutes and it peaks at 90 minutes. What we get is you get a two-stage effect, and it can last up to 3 to 6 hours. It's metabolized by 2D6. I think I have two stages on the next one. It's metabolized by 2D6. So people that are poor metabolizers or 2D6 have an increased risk of fatality with this one because they don't metabolize it and they get higher levels. And it's one of those weird drugs that inhibits its own metabolism. So the more people use, so if they use repeated doses over a short time, they actually start to inhibit its own metabolism, so they end up with higher and higher levels. We see that carbamazepine is another drug that does that. it's an interesting drug in itself, just to study from the drug aspect, as well as being something that kids take to get high. So this two-stage effect is very interesting. So first you sort of get the amphetamine effect. So about 30 minutes after they take it, they get this hyper anxiety, tachycardia, elevated blood pressure. So like they're taking the methamphetamine. Then what happens is they get the serotonin or the feel-good effect. So about an hour after they take it, they get the whole, whoa, this is wonderful, I love everybody. You know, they want to touch people. Then what happens is when it wears off, they get this severe deficit of serotonin in the neurotransmitters, which guess what? What did we study earlier? That's depression. So it's sort of like they overuse all their neurotransmitters. They use them all up. And then when it wears off, they have a deficit. So this is a problem. So they can have this dysphoria that lasts 24 to 48 hours. And so then what do they want to do? They want to take more because they want to get that feeling back because they feel so awful. All right, so it's a tricky one because of how they feel when they don't take it afterwards. So this is a problem. The other problem we have is, remember, we have increased our serotonin effects. So they're going to get serotonin syndrome from this because we now have a whole bunch of serotonin released into the synapse. And so this can cause serotonin syndrome, especially if they're taking like SSRIs already, right? This wouldn't be a good one to combine with SSRIs. And they can also get the sympathetic effects from all the extra dopamine and norepinephrine, so they're going to get tachycardia, hypertension, hyperthermia. They often take them at raves, and so they're dancing for hours, and they get dehydrated and hyperthermic, both a combination of the medication and from the dancing, and they get hyponatremic from the sweat that's happening. And the hyperthermia that can actually lead to rhabdomyolysis and acute renal failure. So they can get pretty significant. They also get liver toxicity. It can be hepatotoxic. It can range from anywhere from elevated liver enzyme to fulminant liver failure with this drug. And they can also cause cerebral infarcts or strokes. And so part of the thing is that we don't know who are ultrametabolizers ahead of time. So we know those people are probably the ones who are probably going to have the more severe effects of this drug. So you take a bunch of kids, you line them up, you take 100 kids, and we know about 5% of the population, Caucasians, are ultrametabolizers for 2D6. So you take 100 kids at a rave, you're going to have 5 of them that are going to have an exaggerated response, and some of them are going to have these toxic responses. And that's what's scary about it. Because their friends are going to say, I've taken it before, it's great, it's no problem. But we don't know if this new kid is a problem, it's going to be an ultrametabolizer. So that's a problem. And that's why you end up with kids in the ER with this stuff. Long-term effects, we have done this surge of serotonin. There's a concern that it may damage the serotonin receptors. We do know that they perform poorly on cognitive tests for a period of time afterwards, and that some kids can actually have depression that lasts a really long time. These probably were the kids that have subclinical depression already, that already had low levels, or have abnormal receptors or whatever's going on with depression. And now we've done something to sort of use up all the serotonin, and now they're really have a deficit. So that's what's kind of scary about this, because, and who's going to go to a randomized controlled trial of this drug? Nobody, right? All we have is what shows up in the ER to collect data on. Okay, so what do we do if they show up? If they are stable, we just treat them symptomatically. We may give them some IV fluids. If they have toxicity symptoms, it depends on what they have. If they have serotonin syndrome, you teach them one way. If they have dysrhythmias, you're going to probably give them an antidysrhythmic. If you have a kid that is having hypertension, you have to get them antihypertensive. So we sort of follow the symptoms. They all need oxygen and IV fluids as soon as the ambulance picks them up. that sort of gets them started because most of them have hyponatremia. The hyperthermia is pretty significant. Jim says they put ice bags under their arms. They give them ice saline lavages, ice bags in their groin. They got to get that. They're trying to cool these kids down. And it's pretty scary when they come in hyperthermic like that. They can have renal failure. They can have rhabdomyolysis. So we monitor the urine output looking for that. They can have seizures and muscle spasms. We want to give them benzodiazepines for that. And then, of course, long-term care, they can be depressed. And so, this is a drug I personally wouldn't want to mess around with because nobody's controlling its manufacturer. You don't know what you're getting, and you don't know who's going to have a bad trip. So, anyway, I think, why do they do this? But they do, all right? They're kids. All right, so bath salts. So bath salts are not bath salts like we all go to the Bed and Body Shop and we buy some bath salts and we put it in our baths. These are actually synthetic stimulants. And there's two of them. They are methadone and MDPV. They're labeled bath salts and their label says not intended for human consumption to get around some of the regulation, right? Because if you label them that way, then why would anybody take bath salts? Come on, you're not supposed to be taking bath salts. So anyway, they are synthetics that are similar to amphetamine. And like the amphetamines, they increase the dopamine, norepinephrine, and serotonin release, and they give a stimulant effect and euphoria. The MDVP acts like dopamine and norepinephrine inhibitors, and they get stimulation and euphoria also. So these are interesting in that you get, they work to block they think this one blocks the receptor, so you get more in the synapse. So you get basically like taking an amphetamine. They're snorted, they can be injected, they can be used rectally, which I was like, what? What teenager is going to use it rectally? But, they put tampons soaked in vodka in, so, come on, I guess that's things. So if they snort it, they have a pretty quick onset of action. It peaks in about 45 minutes, and it lasts for up to 2 hours. The methadone, the MDPV, it onset is an hour and lasts for about, peaks at 90 minutes. These are not going to be picked up on standard urine drug screens. So you're going to have these kids that look like they've taken a stimulant and their urine drug screens are going to be totally normal. Jim was telling me a story about a kid who showed up at the ER, didn't know where she was. The parents brought her in. She goes, I didn't take anything. She didn't know who her parents were. She was like totally out of it. And they finally went through her purse and they found a little package, bath salts. That's what they figured she took. It isn't going to come up. They just assumed it. They finally got her to confess after she came down and came with it. These need to go to the emergency department because of the stimulant toxicity. They can get agitation and seizures. If they get seizures, we treat them with benzodiazepam. Lorazepam is usually what we give. We need to monitor their heart and kidney function because they can have renal failure with this one. We do a CBC, metabolic panel, urine tox screen to see what else they took. Once again, these are available over the counter. I have a couple minutes. So my brother went to France, and he thought he was buying some fleur-de-lis at the farmer's market. And he bought it, and he brought it home, and he made some salsa, and the salsa tasted really weird. So then he went and converted from French to English and realized he'd taken bath salts. And he's tachycardic, he's hypertensive, and so he goes to the emergency department, and he says, I ate some bath salts, because I bought it, and I didn't know French. I thought it was salt. And so they're all worried, and they get him in there, and so when he figured out it really was bath salts, it wasn't this bath salts, it was really the stuff you use in your bathtub. And he was tachycardic and hypertensive because he was so stressed out about it. And so the nurse says, this is the best laugh we had all day. And he's just like, he laughs and he says, this is why you have to like understand the language, because bath salts are bath salts are bath salts. So illegal bath salts are not bath salts that you use in the bathtub. But if people say they did bath salts, ask them what bath salts, because you're going to get kids who heard that you get high on bath salts. They're going to go down to the Bath and Body Shop and they're going to buy some bath salts and they're going to go, okay, that's not what they're talking about, okay? And they're probably just going to get sick to their stomach than not, Anyway, it was just funny. And it's a good story. And he is okay with me telling it because it really happened. So, okay. Dextromethorphan. We're back to what we talked about a while ago. Dextromethorphan, we've got these kids that are abusing it. So we've already talked about the fact it doesn't work for coughs, and now we're going to talk about the fact that kids are abusing it. Do not be surprised if this is taken off of an over-the-counter drug. It's not going to surprise me. So it's known as the poor man's PCP. And the tablets, the dextromethorphan tablets, are known as Skittles on the street, okay? It has had over 30 years of reports of abuse. So this is not new. It's just new that the kids have figured it out and they're abusing it. It is a D-isomer of codeine analog, levorphanol. And so basically, what you're getting is they're getting high because you're getting sort of these codeine effects. It really does work as well or not as codeine for cough, but if you take high doses of it, you get a PCP-like effect. That's why it's called the poor man's PCP. And it also gives an effect similar to ketamine. And so, let's say you've never heard of this, and you say, how do you get high with Dex? I've taken that a lot, and I've never felt anything. And so there's actually a website called The Beginner's Guide to DMX. And it will tell you how to get high. The other thing that dextromethorphan does, it inhibits the reuptake of serotonin. We already talked about that with SSRIs, but actually we also have to worry about this now because they're going to take a lot of it. So if you go to the Beginner's Guide to DMX, which is another term for dextromethorphan. This is also at the DEA website, by the way. This is where I got mine because I figured they really knew their stuff. But you can go to this website, just Google it, and so they tell you how much you have to take in order to get how high you want. So if you want just a little bit of high of a stimulant, you take a little bit. If you want euphoria, you have to take 200 milligrams, okay? And if you want to get like a real hallucinogenic effect and have dissociative sedation, you got to take a lot. So does anybody remember what the normal dose for, you read on the label you're supposed to take for a cough? 30. Yeah, it's 10 to 30 milligrams every 4 to 6 hours if you're not doing the long-acting one. So we're talking, 100 times, a lot. We're taking a lot more. So 10 times, just to get the mild stimulations, 10 times the lower dose. And if you're looking at the higher dose, 30 milligrams, you're going to get more. So there's actual instructions on how to do this. If they get to 120 milligrams, which is 2 milligrams per kilogram of body weight, that's where you get the PCP effects, all right? So anyway, one of the problems with this, though, is that it usually doesn't come by itself. Now, if it's guaifenesin and dextromethorphan, so Robitussin DM, the guaifenesin makes people nauseated. So if they're drinking Robitussin DM, they're probably going to puke because it just makes you nauseated. But never fear, the internet tells you how to avoid puking with this. You're supposed to take the tablets. You're not supposed to drink the liquid. So you go by the tablets, the cough medicine tablets, and you take that to get enough. The problem is most of those tablets are combined with something else. So there's analgesics in there, so you have to worry about acetaminophen toxicity. There's decongestants, so you have to worry about sympathetic system overload. There's antihistamines, so you have to worry about anticholinergics. Remember that atropine poisoning mnemonic that we had to learn a long time ago? Yeah, this is what you're going to see. Mad as a hatter, red as a bat, whatever that one is. Anyway, so that's the problem with the tablets. They're going to get all these other things. And if they're doing NyQuil, which has all of those things, and alcohol, they're also going to get alcohol poisoning if they're taking enough to get high off the dextromethorphan. So that's a problem. So we do need to think about, not only do we need to look at that, but we have to do an acetaminophen level, and we think about anticholinergic toxicity. When they do it, it takes about 20 minutes to get the effects, and they'll start to get high pretty quickly. We know that about 5 to 10% of Caucasians, Europeans, and Mexican Americans are poor 2D6 metabolizers, so they're not going to be able to break it down, the dextromethorphan, into dextromethorphan, so they're going to be at risk for toxicity. And that extensive 2D6 metabolizers, so those are people that break down codeine faster also, they are going to have more euphoria with this. So once again, we got our kids lined up. Some are going to be low metabolizers, some are going to be ultra metabolizers, and they're all going to have a different trip, and they're going to think they had a great time. Okay, so this is concerning the intoxication is based on their dose and how much they take. We do have to worry about sort of nystagmus, dilated pupils, all the things you would see with toxicity of an opioid. They can have diarrhea, they can have hyperthermia, they can have a psychosis. Well, anything that's going to give you hallucinations can give you psychosis, right? And you will have kids that can ingest enough to get a coma. Because if you have dissociative sedation, that's like one step before a coma. And that's really close. One of the things we're seeing, just like opioid use, it's a similar chemical structure. You can have dependence and a withdrawal symptom. So if they take it chronically and they stop using it, they'll have withdrawal symptoms. And then we already talked about SSRIs and serotonin syndrome. And also, if they combine this one with ecstasy, they're going to get serotonin syndrome. So that's pretty scary. If they show up, there's actually a standardized treatment developed by the American Poison Centers, and it starts with the ambulance crew that picks people up. And if it's been very recent, we give them activated charcoal. If it's more than an hour, they have to go. In the ER, they sort of do standardized treatment. Naloxone, which is Narcan, can be administered, but you have to give a really high doses to sort of reverse some of the sedation effects of this. Not like standard Narcan doses. You have to give much higher doses if they're sedated or in a coma. So these kids usually need supportive care. They can end up in the ICU on a ventilator, depending on how much they took. 2CE, this one is some guy down in California, is Alexander Shulgren, has his whole life he's developed these hallucinogens. He gets one that he develops, and then he gets another one, and then another one. This one is we don't know a lot about it, because about the time we figured out, he develops a different one, so he's got probably 2CF or 2 whatever. This one, we know that there's been some fatal leukoencephalopathy from it. We've seen some people with methylmethylglobinemia from this. It's a hallucinogen. Crocodiles. Anybody seen this? Crocodile? I mean, who would take this stuff? It's like heroin. It's a combination of codeine, lighter fluid, and industrial cleaners. It's 8 to 10 times. I know my time is up. Give me like 3 minutes and I'm almost done. 8 to 10 times more potent than morphine. It's way more addictive than morphine. And because they inject it, it causes this... Well, of course, it's got all these chemicals in it. It's killing off the tissues. Russia has a real problem with it. We started seeing reports here a little over a year ago in the United States. But in Russia, the average life expectancy of someone who uses this is 1 to 2 years. So hopefully we don't see too much of it here. Tobacco and nicotine products, we got all these things kids are using. None of it is legal for kids. We got people using hookahs. 21% of 12th graders are using hookahs. I mean, come on, I can't believe that. Beedies, which are these hand-rolled cigarettes from India and Southeast Asia. Cracks, which are a clove cigarettes from Indonesia. They're using those. Electric cigarette. These are not regulated at all, which are really scary. They're battery devices that have nicotine and other things in them. You can buy them in pretty much any flavor. They have fruit flavors, mint flavors, chocolate flavors, strawberry, gummy bear, Captain Crunch. I mean, oh, come on. Don't tell me you're not appealing to kids with flavors like that, right? Okay. There was, finally someone studied this, CDC looked at this. Kids are increasing their use. Look at this. We've got kids that about 10% of high school students are using electronic cigarettes. This was a year ago. I bet it's higher now. So we have to add this now to the studies of what we're tracking. And they're trying to figure this out because it's not regulated. It's a totally unregulated. So we're figuring out how to regulate it and so that we can get kids not using it. Okay, you guys seeing these in your patients? Yeah? We did have a toxicity of a 2-year-old that drank the stuff and had nicotine toxicity. So that's the other thing we have to worry about. Caffeine and energy drinks. Did you hear about the kid that ordered, the high school senior that ordered caffeine powder and killed himself with it? You can order that off the internet. It was equal to 25 cups of coffee, what he took. So this is similar to theophylline, remember? It's going to give you tachycardia. We've been seeing all these reports. The energy drinks have all these other things in it. It's a CNS stimulant. What we're seeing is tachycardia, and they're having seizures. It's rapidly absorbed. So the energy drinks, if you ever see them, the opening on the can is really big, so they chug it. And so if you're thinking about your coffee, we sip it slow because it's hot. And you can't drink it fast. You don't chug your coffee, right? But the energy drinks, you can chug because they got big holes and they're cold. So they get a faster peak, okay? And that's when they get this sort of tachycardia and stuff. We only have ER reports. We're seeing ER reports all over the place of kids showing up with tachycardia. We've seen some deaths. If they show up, we charcoal them if it's been within an hour. We give them benzodiazepines if they're seizing. If their caffeine levels are really high, we can do hemodialysis to bring it down. And the other thing they're doing is they're combining the energy drinks with alcohol. So we're also seeing them coming in with combination of alcohol poisoning and caffeine toxicity. Hand sanitizer. This one is just weird. You can go to the internet, and if you ask, Purell shots, just Google it, Purell shots. It will tell you the recipe of how to distill the Purell to get pure alcohol. The problem is when you make it, it's 60% alcohol. So, normal, like whiskey is like 40%. So these kids can go and buy, do you think someone at the store, if they come with a big thing of hand sanitizer or a bunch of teenagers, someone would think there's something up, right? But so they're doing this, they're showing up with alcohol poisoning from hand sanitizer. And there's a recipe, they separate it, the glycerin out, they strain it through cheesecloth, and they get pure alcohol. So there you go. All right. So kids are creative, right? They're always doing something we would never think of doing. And if you do a urine drug screen, you may not pick up the majority of these things, okay? So I'm sorry I ran a few minutes over, but I thank you for hanging in with me all day.